Assalamu alaikum. Today our topic is nebulization procedure. Although we all know how to nebulize, but still there are some common mistakes happen during nebulization. So our objective is to improve good and safe nebulization practice according to the guideline. This step-by-step tutorial will show you how to nebulize and what medication are effective. Nebulization is a process that turns medication into a mist so it can be inhaled. Before starting nebulization, hand wash is necessary. After washing hands, put medication into a container. So the patient which will be nebulized should be in the sitting posture. The best posture for the nebulization is sitting posture. If the patient is bed bound, then he should be elevated on the bed with 45 degrees angle. If you nebulize the bed-bound patient less than 45 or 30 degrees, the mist will not form effectively. The solution is tilted, the container is tilted, so solution will be not effectively form the mist, which is the must to be inhaled for effective nebulization. So once you make the patient on 45 degrees, then you can put the mask. Nebulization either by the two ways, either through the mask or through the mouth tube. This is the face mask. The face mask should be tightly fixed on the face, not loose. If it is loose, the mist can be released from here to the eyes, which can be precipitate some eye disease in some patients. So face mask should be tight enough to make the effective nebulization and mist inhalation. The second is through mouth tube. This is a mouth tube. The patient should keep the mouth tube in his mouth. All the mist should be inhaled from the mouth to the lungs. So this is the better than the face mask. In this, what is the advantage? The mist all can be inhaled easily to the lungs. In the face mask, some mist can be leak out from the face mask, which is not good for the face and eyes problem. So once you nebulize, then either by machine or by the oxygen. In cases of COPD, the patient with type 2 respiratory failure and COPD patient, they should be nebulized with machine. Always remember, they should be nebulized with nebulizer machine. Only those patients whose carbon dioxide in ABG is normal and those patients with asthma and other lung diseases whose carbon dioxide is normal or low in the ABG, then you can nebulize with oxygen. How much oxygen you need for nebulization? According to guideline, 8 to 9 liter. Not more than 9 liter, not less than 8-7 liter. Because to be effective, 8 to 9 liter is the proper oxygen in liters. 8 liters to be form the proper mist and proper inhalation. Other solutions which is available is strong and principal bronchodilator salbutamol is the #1 choice for the patient with COPD and asthma exacerbation coming in the ER, admitted in the ward. They should be nebulized with salbutamol until there is some contraindication. So don't afraid to be nebulized with salbutamol, because it is seen that most of our juniors are avoiding Ventolin due to fear of tachycardia. But actually the tachycardia usually in exacerbation due to hypoxia in COPD and asthma patient and other respiratory condition patient. Tachycardia mostly due to hypoxia. Avoid only salbutamol in cases of thyrotoxicosis, the non-arrhythmias patient and severe heart failure. That time you can avoid the salbutamol. Those patients with normal heart and mildly elevated heart rate more than 100, 110, 120 due to bronchospasm and hypoxia, you can nebulize with salbutamol. So how much you can nebulize depend upon the patient condition and the heart rate, either 2.5 milligram of salbutamol or 5 milligram of salbutamol. 0.5 ml solution contain 2.5 milligram, while 1 ml contain 5 milligram of salbutamol. Both concentration should be diluted with 2 ml and 2.5 ml of normal saline. So if you take 2.5 ml, dilute with 2 ml of normal saline, and if you take 1 ml, then dilute it with 2.5 ml. Salbutamol relaxes all the smooth muscle of airways starting from the trachea to the terminal bronchioles. And as you know, there are beta 2 receptors in the pulmonary and heart. So there are abundant receptors in the pulmonary surface, and salbutamol is 29 times more selective for beta 2 receptor than beta 1 receptor, giving it higher specificity for the pulmonary beta receptors than the receptor in the heart. So once you nebulize with salbutamol, they are mostly the receptor occupied in the respiratory surface, unless the patient has some cardiac condition. Once you give the salbutamol, it decreases air resistance within 5 to 15 minutes after inhalation, and maximum improvement in 60 to 90 minutes of bronchodilator effect. The second available bronchodilator is ipratropium bromide. Ipratropium bromide is the muscarinic anticholinergic, and it occupies the muscarinic receptor. So after the nebulizing with salbutamol, second nebulizer you can start with ipratropium bromide in cases of COPD and asthma exacerbation in emergency and the wards. So either it contains 2 ml solution contain 500 microgram of ipratropium bromide. You can nebulize with 250 microgram, half ampule, or one full ampule of 500 microgram, and diluted in the same concentration of 2 ml and 2.5 ml of normal saline. The most common side effect of ipratropium is dry mouth. So you can see in the wards there are many patients complain of dry mouth once they have the 6 hourly or 8 hourly nebulized with ipratropium bromide more than 2-3 days. So once the patient has significant complaint dry mouth, you can either decrease the frequency of atom nebulizer or decrease the dose of atom nebulizer. Second side effect of the nebulizer solution with the ipratropium is those patients with preceding eye condition like glaucoma. So it can precipitate the mist which form in the nebulizer during the face mask, can goes to the eyes and precipitate acute glaucoma cases in patient with glaucoma. And then other side effect is in patient with prostate hypertrophy, it can happen as the retention of the urine. So be careful in these patients to be used atom. The third nebulizer solution is available in the market is beclomethasone in the name of Clenil, and it is seen that most commonly we use Clenil for many patients instead of Ventolin salbutamol. So multiple studies done for the beclomethasone, and it is seen that it is not effective in cases of acute bronchospasm in the emergency room and in cases of COPD and asthma, which came with the acute exacerbation. And those patients who are steroid dependent, moderate to severe stable asthma, and they are using inhaler which is ineffective or they are unable to use, then you can switch them to the nebulization with Clenil compound, Clenil beclomethasone. The studies only shows Clenil beclomethasone effectiveness in children less than 5 years of age. So in children less than 5 years of age, you can use primarily the clinal nebulizer instead of Ventolin and Atom, those patients with acute bronchospasm, those children with acute bronchospasm less than 5 years of age. Side effects of beclomethasone, the most common one is the oral candidiasis and hoarseness of voice. Less common is pneumonia and skin bruising. So should be careful once you nebulize. If you want to nebulize with clinal, if indicated, it is better to nebulize with other solution according to guideline. Then you have to do the nebulizer care. So once you finish the nebulizer, it is better to wash the nebulizer parts after every nebulization. But because of in hospital it is overcrowded, it is not possible. So at least once 24 hours you can ask the patient to wash the nebulizer mask and the container with the warm water or the normal water. Also you can dry the tube of the nebulizer machine by just putting the tube one end in the machine, one end held in the hand, and then you can start the machine. So nebulizer compressor air will go from the tube to other hand, it will go out. So nebulizer, this tube will be dry. This is the method of drying the nebulizer machine wire, the tube. So nebulizer care is very important. Then also for watching this video and subscribe this video for the further more videos on other topics, and make the good practice of nebulization, which is necessary to be effective nebulization for every patient, either in the hospital or your relatives at home. Thank you very much.